Lots of us senior citizens are spending a lot more time taking care of ourselves. And by the way, senior citizens might even include you people in the 50s and 60s. We take care of ourselves with much more exercise, we're watching our diet, we're taking supplements, we're spending a little more time reading the papers regarding what's important to our health, and we're enjoying the benefits of it because medical science says that living this healthy lifestyle will help us to live longer, decrease the chances of heart disease, and even cancer. The one thing we don't discuss too much, however, is Alzheimer's disease. Why? Because we know what it is. It's a progressive loss of our mental functions. It comes on without much warning. It can come on at any age, even in the 50s and 60s, and it becomes progressive to the point where a person loses their ability to know who they are, how to function, and it's a terrible burden on their family. Another aspect which is even more discouraging is the fact that the world of medical science seems to have very little to absolutely no treatment or even early detection of this condition. But in truth, there is some early treatment which I want to discuss with you in just a few moments. But first, let's talk about what's the difference between early Alzheimer's and just getting old. It's not so easy to distinguish, but let me give you just a few basic, easy guidelines. Okay, when I lose my keys at the house for a little while, or I can't remember where my glasses are, but I find them, these things are okay. It happens to all of us. They're called senior moments. But when a person starts to have their lifestyle really affected because they're progressively losing things, they can't find things, that's not okay. That's not good. If you get in your car and you're going to go visit an old friend that you haven't seen for a while and you can't remember the address exactly how to get there, that's okay. But if you're driving home from the food market and you get lost and you can't find your way home, that's not okay. Again, if you go to the supermarket, you come home, you forgot the milk, that's okay. Happens to all of us. But what happens when you get home and you unpack all of the stuff that you bought and you can't remember why you bought it or what you're supposed to do with it? That's not okay. If you or someone that you know, loved one, somebody else is starting to suffer from these progressive things, they should be seen by their family doctor and or a neurologist because there are conditions such as anemia, high blood pressure, diabetes, which may cause some of these symptoms and can be treated. But what if you go to the doctor and you are evaluated and you don't have any of these things? You just have a little bit of, progressive old age. Usually the doctors don't have very much to offer you except, keep up with your healthy lifestyle, exercise and stuff like that. But with Alzheimer's disease, that's not a very good option. So I wanted to discuss with you what is a newer, I think more natural and hopefully very effective idea in terms of treating early onset Alzheimer's disease. That's in the next video. I ask you to spend a few moments to look that over. It gives you more specific details about the concepts of Alzheimer's and what can be done in a more natural and effective form. Thank you.